Hi, I'm Steve Adubato. We're going to have a compelling, important, and very relevant conversation about autism, the autism community, and the impact of COVID. We're honored to be joined by Michele Adubato, is the CEO of the Northward Center and the founder of the Center for Autism, and yes, my sister, Michele Adubato. Dr. Suzanne Buchanan, not my sister. She's the executive director of Autism New Jersey. And finally, Nadine Wright-Arbubakrr, who is the founder and president of Nassan's Place. I want to thank you all for joining us. Michele, let's jump right into this. You have been dealing with the autism community for over 2 decades, correct?
Yeah, close to 3.
Put this in perspective. The greatest challenge or challenges facing the autism community since March of 2020 are?
First of all, let's just go back for just a second, and then we'll talk about the challenge, because the number one thing that happened to our autism community is that we were shut down. And in an instant, people whose lives were based in routine and structure just went away. The mental health impact of that and the physical impact of that and just moving around was extraordinary for our community of people with autism. So one of the challenges, I think the greatest challenge is, how have we navigated that, in our community? Because many of our community programs have been shut down, rightly so, by the state of New Jersey, because it's just too dangerous to open. We're changing that now. So I think that the major challenge has been how do we reopen and how do we bring back that daily routine that is so important for our community of people with autism.
Nadine, let me ask you this. Nassan's Place, you've been with us before. Make it clear, put in context, Nassan.
My son's life, as Michele. Hello, Michele.
Nassan's your son.
He's my son. His life, as Michele said, was turned upside down. Children were taken out of their routine. Regression started to happen. It was very challenging to get him back into some type of routine, being home and not being able to get up in the morning, go to the bus or his transportation, go to school and come home. It was very challenging, and it continues to be even more challenging for a lot of our families as we continue to cope and deal with the COVID-19 pandemic.
Suzanne, what's interesting to me? I mean, we're taping this on the 22nd of April. It'll be seen after. 14 months plus into this pandemic. I don't remember one compelling, detailed, substantive, long-form news report on the impact of COVID on the autism community. We in the media have fallen woefully short, have we not?
I think there's been some coverage, and it's been very
not enough.
No, not enough, but there have been some reports, and I think it's also a symptom of the pandemic itself, where we all kind of mentally and physically went into a lockdown survival mode. And unfortunately, people with disabilities, especially those with intellectual disabilities, sometimes go into the shadows in those times. And that's what's happened here. I think the number one concern, obviously for everyone, but particularly for people with autism, has been health and safety, because many individuals with autism and intellectual disability don't understand what a virus is. They don't understand the risks. They still might not wear masks. They still may touch their face and touch other people and stand too close. And so the things that, we all picked up pretty quickly have taken months, if not, some individuals still haven't learned these things. So they're, obviously greater risk for COVID infection because of the, the kind of the educational and day program type structures that they need, where they need individuals close to them, sometimes for physical prompting to get through activities. They're just at much greater risk overall.
So Michele, help us on this, because those of us who have children who are not on the autism spectrum listen to our kids talk about how challenging it is to, quote, learn remotely, teachers teaching remotely. What are the challenges facing those on the autism spectrum of a certain age who are in school, quote unquote, learning remotely?
Well, I don't think that it goes into just one category, because I've heard varying stories. Yes, I'll give you an example. My grandson, who's 4 years old, who's diagnosed at 2, mild autism. Forget it. with virtual. We tried virtual preschool and he's like, I'm not having it. So we were able to do some other things for him. I think the younger the more advanced autism is, I think it's more of a struggle. I have heard from other parents, from people falling on the Asperger's end of autism that said, this has been their greatest year. How about that?
Really?
Yeah, it was
Because?
because it was one-on-one attention and there was no socialization. How about, so like they didn't have to be, looking at, who's looking at me, I'm not being played with in the recess time, and all those other things went out the window. Now, I'm not saying that that's the overriding story, but I don't think it can be really put just into one category.
There are
But
different
overall,
experiences.
I would say it's been very difficult for everyone. But I don't think it was a complete number one, like it didn't work, but
Right.
certainly it's not the solution. We
Nadine,
need
let me
to
ask
get back in person.
Nadine, let me ask you, for Nassan, be more specific. What has it been like?
He wasn't
How old
having
is
it, just like Michelle's grandson wasn't having it.
How old is
They-
Nassan?
Nassan is 16 years old.
Okay.
He's nonverbal. Nassan is on the lower end of the autism spectrum. So he's not that kid that understands ABC 1, 2, 3. So it was a huge challenge and it did not work for us. And it's not a one size fit all, where some families it works for and some kids it don't. I mean, I got calls from some of our families that the kids were throwing the Chromebooks because they felt like they were being forced to sit in front of something that they're not accustomed to doing. But for Nassan, it definitely was not workable for us at all. I got to tell you, though, a big thank you and shout out to New Jersey Regional Day, which Michele was at the helm for many years.
She was the principal there.
Right. They did a phenomenal job in reaching out and working with me as a parent to make sure that Nassan continued to get his needs met, from speech to OT to actually doing some of the daily living skills that he needed and some of the educational needs. But I was very fortunate in this instance because Nassan also gets outside ABA, and we did not miss a beat. Through COVID, he's continued to get his 20 hours of service. Thank God my ABA therapist lived around the corner. So we had a lot of support for him, but the remote learning was definitely not going to work for him.
By the way, if you just joined us, we're talking about the impact of COVID-19 on the autism community. Michele Adubato, Dr. Suzanne Buchanan, and Nadine Wright-Arbubakrr joining us. By the way, to disclose, the Northward Center is a supporter of what we do, particularly in the area of autism awareness. Suzanne, let me come back to you. Is it true that people who are dealing with COVID, people dealing with autism are more likely to get COVID, or is that a misnomer?
Well, I think, the research is still emerging on all of that, but there do seem to be a lot of higher risk behaviors, like I described before, like standing closer to other people, not wearing masks, all that. So yes, it is, the findings are certainly trending in that direction. It's been difficult from a research perspective to separate out individuals with autism, like with and without intellectual disabilities. Sometimes people with all developmental disabilities are put into one kind of research category, but it's, common sense would say that there's more risk.
Michele, go back to the whole question. Nadine mentioned the Chromebooks. Put the Chromebooks in perspective. First of all, what are we talking about? Why is it relevant to this discussion? And they're not cheap.
No, they're not. And I would agree with Nadine that, the overall feeling that it's been very, very difficult for people with disabilities to do virtual learning. I just did want to point out that there has been some instances where that it hasn't been as bad. Now, that being said, Chromebooks were the number one thing that from a technology standpoint that, was the easiest thing to use, but it's not so easy to get. And especially when the pandemic hit. I mean, we were waiting for months and months. So, we had to beg companies, to give us, and we were able to get donations and all of our Center for Autism clients a Chromebook. And we have still been virtual, Center for Autism, which is to me an extended learning situation. So, I was the principal of Regional Day School, and I'm so proud of Regional Day School that they've
Tell everyone what Regional Day School is, and not everyone watching in New Jersey and surrounding states know exactly what it is.
So Regional Day School is a special needs school, one of the few that are still around, and we do need them, that are just geared towards people with autism, ages 5 to 21. And I was very proud to run that school for over 20 years with our leadership team. And the bottom line is they're right in the heart of it. But what happens after 21? And that's, the same type of situation that we were in at Center for Autism. So Center for Autism really is an extension, if for lack of a better word. Sometimes they call it the Regional Day College, like they go off and because number one,
but age-wise, Michele, help people understand. The government has certain regulations. Aging out is a funny term. What does aging out in the context of this conversation actually mean?
So aging out of the educational system means 21 and over. So
what's supposed to happen
at
21?
It depends on where you are and where you live, unfortunately, because some people could call it falling off the cliff. And in many places that happens. That's why the Center for Autism was founded, because there really wasn't any place for students and people with autism in our Newark area, greater Newark area, to go after 21. But we're having the same type of issues in terms of COVID. We are now having the discussion, like we've got everyone a Chromebook. Thank you. That's wonderful. By the way, 100% of our staff have been vaccinated. This pandemic has shown this in our community. We are so interdependent upon each other that you can't solely make a decision. And I think people need to understand this. When we make a decision whether to vaccinate or not, okay, we're not just making a decision for ourselves. We're making, I can give an example. We cannot open, and we want to open. We cannot open
Center for
Autism right now.
You can't. As we take, you can't.
We cannot.
Michele,
Michele, there's a time issue
today,
here. So
I
Michele,
know, Suzanne, there's been a change.
Just today, the State Division of Developmental Disabilities issued updated reopening guidelines that allows programs to open, but uses the COVID index to determine the capacity.
Okay.
And if you're in an urban, here's the deal. Ready? If you're in an urban area, it's not good because we're on that higher end color.
And you are there. You're in an urban area. And
we're orange, red.
Okay. And let me ask you, Nadine, what happens? This is so interesting. For you, what is the message you would want to send to those watching right now on public television, other platforms, but primarily public broadcasting, who are not dealing directly with having a family member on the autism spectrum, but are empathetic and want to care? What could they do? How could they be helpful?
Just to piggyback off of Michele again, Chromebooks was a hot commodity for a lot of our families. We were not ready for the pandemic. I think that it gave us a wake-up call for our school districts and our communities, because my thought process is that, first of all, we were behind the technology hardball, so to speak, because when this pandemic happened, there should have been a Chromebook in each of those schools that should have come home with those children when the pandemic hit.
And who should have provided them?
I think the school districts have an obligation, and they should have provided one, because each and every student should have had one. And unfortunately, in some urban inner cities, they fell short, and children with special needs were kind of left out of the loop. Nassan's place was in the midst of ensuring that we got as many Chromebooks out as we possibly could. And we're a small nonprofit, grassroots. I'm so thankful for the donations that came in, because not only did we have to get Chromebooks, you now had to realize these children were taken out of their day-to-day school settings. Parents didn't have the same items that the school districts had for their children. So we had to buy sensory items to get into some of those homes so that those children had some type of normalcy. Those who could do the remote learning, we provided trampolines, we provided sensory items, we provided balls, we provided chairs, we provided desks that made it comfortable. We did whatever we could.
But nonprofits led that. I'm so sorry, I got about a minute and a half left. So nonprofits provided that. Michele, was there corporate and or philanthropic support for the
Yes.
Chromebooks?
Yes, there was. We were able to work with the Healthcare Foundation of New Jersey. They've been very generous with us and very quick
Right.
to respond.
So the foundation community supporting not-for-profits directly who are providing direct services to those on the autism spectrum. That's a key to this. So government, real quick, got a minute left. What's the role of state and or federal government in this? Michele, go, got 20 seconds, go.
To support the nonprofits.
What does that mean? Direct dollars?
Absolutely, because it gets truly funnel. When we talk about the funnel down approach, it is the nonprofit. It's the nonprofit that can help grassroots programs like Nadine's, which we have. And so if you want to funnel the money correctly and directly, you want to go through nonprofits that are at the core of every community.
Did the stimulus package have money going directly to the autism community? The Biden stimulus package, is there direct money going to the causes that to the needs and the services you just laid out?
I don't know if Suzanne wants to answer that.
Suzanne, real quick, is there money directly there?
There are some stimulus payments
Right.
going to individuals 16 and over, and there are billions of dollars being poured into home and community-based services. How that actually funnels down to the local level and to the individual family remains to be seen.
Who's in control of the money?
Federal and state government.
So the federal and state government ultimately decide what gets to certain nonprofits or not, correct, Suzanne?
Correct.
I think what Suzanne is saying is there hasn't been a direct fund. There hasn't been a direct connection yet.
Right. And I just like to pick up what Michele said about getting vaccinations.
A few seconds, go ahead.
We have a special needs clinic with the Visiting Nurse Association of Central Jersey that has not only special accommodations, but what I would call intensive special accommodations. And we encourage anyone to go to our website at autismnj.org to learn more about getting vaccinated.
We'll put your website up. Yes, Michele. I said 4 times. This is what happened in our family dinner table. I say we got to go, and she say something else. Go, Michele.
Real quick, it's not what you do. It's not what I do. It's what we do together, and that's what we've learned.
By the way, everyone's website's been out throughout this entire program. Go to find out more information. This will not, I promise, be the last conversation about the impact of COVID on the autism community. So complex. Michele, Suzanne, and Nadine, I want to thank you so much for joining us. We appreciate it.
Thank you.
Thank you.
Stay with us. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by PSC&G, the Healthcare Foundation of New Jersey, University Hospital, Prudential Financial, Summit Health, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, the Robert Wood Johnson Foundation, and by Rutgers University, Newark. Promotional support provided by NJ Biz and by CIANJ and Commerce Magazine.
Hi, I'm Joe Roth. In New Jersey, there are nearly 4,000 residents in need of a life-saving organ transplant, and one person dies every 3 days waiting for this gift of life. One organ and tissue donor can save 8 lives and enhance the lives of over 75 people. You have the power to make a difference and give hope. For information or to become an organ and tissue donor, visit www.njsharingnetwork.org and be sure to talk with your family and friends about this life-saving decision.